I will bring about the practical application and cases analysis of body mapping. I will talk about in the following parts, which are the practical application examples, cases analysis, future practical direction, and conclusions and suggestions. First of all, I will talk about the workshop and group treatment, which included the implementation workshop. And first, let's talk about the steps and setting of the workshop. The theme setting. Set the theme according to the purpose of the workshop. For example, the topic of anxiety management can guide participants to pay attention to the feeling of anxiety in the body. The theme of trauma rehabilitation can be developed around strength and vulnerability in the body. Set a clear intention so that participants can understand and focus on physical perceptions. In the therapeutic environment, it is emphasizes that this is a space of self-exploration and no judgment, and any expression is accepted and supported. For the preparation of material, we will need some papers, painting tools, and other tools. Some largest sheets of paper such as A2 or larger, so that participants have enough space to draw the outline of the whole body. Diversified tools can inspire creative inspiration, such as colored pen, crayon, oil painting sticks, watercolors, markers, and etc. Provides different materials for participants to choose the most suitable tools for their own expressions. And other tools such as scissors, glue, collage materials such as pictures, fabrics, magazine clippings, and etc. can also be used to increase creative diversity and help participants express themselves in a more three-dimensional way. And then, the creative guidance. Before starting to create, lead participants to do a short body scan or meditation exercise to help them calm down and pay attention to the feelings in the body. It can guide them to feel different parts of the body from head to toe and think about whether there is any tension, pain, or other emotional experience in the body. And we can also lead them to do some yoga exercise. And then let the participants lie flat on the large piece of paper and help each other draw their body contours or draw the image of the body on the paper by themselves. This body contour will serve as the basis for the visual expression of their emotions and physical feelings. Guide participants to express their feelings about different parts of the body through colors, shapes, symbols, lines, and etc. inside and outside the body contour. For example, use warm colors to express comfort and security, and use dark or distorted line to express pain or tension. And then we will move to the feedback and sharing section. At the end of the workshop, give participants time to think and write about their feelings. Guide them to think about the experience of the whole painting process, what new physical perception they have discovered, or whether any body parts brings them new perceptions. According to the wishes of the participants, they can voluntarily share their creative contents. This process should be based on support and non-judgment to ensure that everyone feels safe and listened to. If someone is unwilling to share, they can choose to remain silent. Therapists can ask gentle questions to help participants think more deeply about their expressions. For example, can you describe why you choose this color? What do the lines of a certain body part make you associate? And etc. Through these questions, participants are guided to explore the connection between body and emotions at a deeper level. About the reflection and extension after the workshop, it can be suggested that participants continue to use the methods of body mapping in daily life. Regularly check their body feelings or release tensions through painting when they feel stressed. The application of body mapping technology in the group environment has unique advantages, which can not only help individuals explore their own physical emotions and experience, but also enhance mutual assistance and support among group members through collective creation. This interactive treatment methods has significant effects on promoting mutual understanding and in-depth communication, especially in collective creation and discussion. Mutual aid and support for collective creation enhance the sense of collective belongings. In group therapy, collective creation brings the experience of joint participation. Members help each other draw body contours, share materials, or express each other's feelings in a common creative environment. Through this kind of cooperation, members can feel each other's support and companionship, which increases the sense of belonging and trust of the group. For example, a member may feel uncomfortable when drawing the outline of his body, and other members can help to build emotional connection through this mutually supportive way. And also, the empathy and emotional support is very important. In the group creation, the members share their own body mapping with each other, which can evoke the resonance of other members. For example, if a member draws a painful body part, other members may also realize that they have similar feelings. Thus, sympathizing. This kind of empathetic experience can enhance the emotional connection between group members, support each other, and group together. During the workshop, therapists can encourage members to express their feelings about other people's creation and help group members discuss their own experience more openly, so as to establish a deeper interconnection at the emotional level. And also, we will have the common learning from diverse perspectives. Collective creation enables members to learn new expressions and emotional understanding from other people's work of art. For example, one member may express pain through color, while their other members may use symbols and shapes to express repressed emotions. Through these diversified perspectives, everyone can learn new ways of self-expression so as to enrich their own creation and understanding. The group members can discuss choices in the creative process with each other. This kind of sharing helps everyone develop new means of expression in the process of inspiring each other. We also had to promote understanding and interacting through group discussions. Create a safe discussion atmosphere is very important. In the group discussion section, therapists should create a safe and non-judgmental space so that each other and members can feel free to express themselves. This sense of security makes members willing to share their emotions and feelings expressed in the body mapping more openly. By listening to each other and understanding each other, members can be more emotionally connected. For example, in the discussion section, therapists can encourage members to use "I feel," the language in the use to describe and understand of each other people's words, so as to avoid judgmental languages and promote open and inclusive dialogue. Sharing words of art and collective reflection is necessary. When members show and explain their own body mapping words, other members have the opportunity to understand other people's physical experience and emotional words. This kind of sharing can not only help members have a deeper understanding of their own words, but also provide opportunities for other members to reflect. For example, seeing other people's body mapping may make a member reflect on his physical state and stimulate more self-awareness. This sharing process can also deepen interaction by triggering discussion, such as "How do you feel emotions in this body part?" or "How does the color or shape of this part make you feel?" This kind of questions encourages members to think and communicate from multiple angles. The encourage positive feedback and encouragement is very useful for the members. Positive interaction in group discussion and feedback section can improve each other members' self-confidence, especially when they feel supported and recognition from the group. This kind of encouragement not only helps to build emotional bonds between members, but also helps them express themselves more briefly. For example, a member may feel uneasy or self-doubt in his creation, and other members can help the members overcome self-criticism and further strengthen the cohesion of the group by giving positive feedback and support. Promotes the understanding and interaction among members. For example, the expression across language and culture. The body mapping is expressed through art, transcending languages and cultural barriers. In the multicultural groups, artworks can be used as a common language to help members of different backgrounds better understand each other's emotional experience. For example, language barriers may make it difficult for some members to express their emotions clearly through words and through body mapping techniques. They can communicate with others with the help of visual languages such as colors, shapes, and symbols. Explore group resonance. In the process of group creation and discussion, members may find themselves in common and physical perception and emotional experience. This resonance experience helps them feel that they are not alone, and there are similar emotional experience in the group. This kind of group resonance can not only enhance group cohesion, but also make members feel comfort and strengthen in their mutual support. Redefinition of individual and collective relationships. During the workshop, members not only explore their personal physical feelings, but also re-understand their relationship with others in a collective environment. Through the interaction with others, they can better recognize their position in the group and how others perceive their expression. This experience can bring deep psychological adjustment and help them redefine the relationship between individuals and groups. The application of body mapping technologies in the group therapy environment can not only enhance members' self-awareness, but also promotes the understanding and interaction among members through collective creation, sharing, and discussion. Through the process of collective creation, the members support and sympathize with each other, forming a mutual treatment atmosphere. The group discussion section provides the in-depth opportunities for reflection and communication to help members establish emotional connection and group resonance in mutual understanding and interaction. Here are some individual treatment cases, and we have some individualized scheme. First is the specific plan steps. Preliminary evaluation and demand analysis. Before starting, therapists need to understand the individual's background, current emotional state, and treatment needs. For example, whether there is physical trauma, chronic disease, or emotional depression. This information can help therapists set a clear goal for the body mapping process. If the individual has experienced physical trauma, the therapist can pay more attention to which parts of the body may trigger traumatic memory and adjust the discussion methods to avoid making the individuals feel uncomfortable or triggered. The material selection. Choose the suitable materials according to individual preference and comfort. Some individuals may prefer soft watercolors or crayon, while others may prefer to use more intuitive colored pen or markers. Provide diversified materials so that individuals have more choices in their creation. For individuals who are not familiar with or confident in visual expression, choose simpler and non-technical tools such as crayon or pastel to reduce stress. In the creative guidance, help individuals focus on their bodies by guiding meditation or body scanning. Let them feel their bodies from head to toe and observe the tension, pain, or comfort. Then individuals can draw their own body contours on paper and express the feelings of each part of the body through colors, shape, and symbols. If the individual is not suitable for drawing a complete body contour, such as trauma or body limitation, it can be guided to focus on specific parts, such as hand, heart, or head, for local body mapping. 2. The expression and reflection. Let the individual reflect on his work after completing the body mapping. You can guide them to describe their feelings through open questions, such as, which parts of your body do you feel stress or pain? Is it a certain color related to a certain emotions? This stage aims to help individuals explore and understand themselves more deeply. For individuals who are difficult to express their emotions, the therapist can start with a relatively simple observation, such as the choice of color or the shape of the line, and gradually guide them into a deeper emotional discussion. For the discussion and feedback, through the discussion between individuals and therapists, we can further understand the emotions and physical feelings presented in the body mapping. This part should be based on the comfort of the individual, and the therapist needs to ensure that the individual does not feel excessive exposure and pressure during the discussion. Adjust the feedback methods according to the individual's emotional response. If the individuals feel pressures or mood swing, he can slow down at the right time or choose to pause the in-depth discussion, but focus on the establishment or safety and comfort. And then need to adjustment according to the individual's needs. For individuals who have experienced physical or emotional trauma, therapists can avoid direct contact with the trauma site, but guide the expression in a more abstract or metaphorical way. Therapists should remain sensitive throughout the process to avoid triggering traumatic memories. Cultural difference may affect individuals' perception and expression of the body. Therapists need to respect the individual's cultural background and understand how they view the body, emotions, and symbols of expression. Adjust the creative tools and process according to the individual's interest in visual arts. If the individual is not familiar with painting, the therapist can provide simple and free creative guidance, reduce technical requirements, and increase personalized expression. The individual creative process in art therapy, especially when it evolves in the drawing of body images, individuals express their own feelings through art and explore the relationship between body and emotions. This creative process usually involves drawing body images, choosing colors and shapes, expressing emotions, and other links to help individuals understand and express themselves more intuitively. Key steps in the creative process. First is the drawing of body contours. The first step to creation is usually to draw the outline of the body. Individuals can choose to draw the whole body or focus on certain parts. This step helps individuals establish a basic visual perception of the body and lays the foundation for subsequent emotional expression. Therapists can guide individuals to perform body scans to help them realize the feelings of their bodies before drawing and enhance their awareness of the body. The choice of colors. Color is the core tool of expressing emotions. Individuals can choose different colors to represent specific emotions or physical feelings according to their personal understanding and feelings of color. For example, red may represent anger or pain, and blue may symbolize calm or sadness. Encourage individuals to choose colors according to their intuition instead of deliberately considering their symbolic meaning. The freedom of color selection is conducive to the natural flow of emotions. The use of shape and lines. The expression of shapes and lines can also convey emotions. Individuals may use soft curves to express calmness, or sharp lines to represent tension and anxiety. Shapes can also be used to symbolize the emotional state or pain of certain parts of the body. Guide individuals to try to express their inner emotions through different lines, and help them explore how the speed, pressure, and etc. of lines are connected with emotions. Therapists can encourage them to try combination of different shapes and lines to enrich emotional expression. For the visual expression of emotions, on the basis of body images, individuals can further express the emotions or feelings of various parts of the body through colors and shapes. For example, use dark colors to express tight body parts, or use patterns to symbolize the expressions of certain emotions. Artistic creation has become an external tool for them to explore their physical and emotional states. Encourage individuals to project emotional experience to different body parts to help them realize how emotions are stored in the body. For example, they can add more shapes or colors changes to specific parts to explore the interaction between body and emotions. The analysis of key steps is the connection from body to emotions and balance between the spontaneous and structure, and also the application of emotional and color psychology. The next part, let's talk about the clinical practice. When applying body mapping technology in a clinical environment, therapists need to conduct detailed evaluation and planning to ensure that the technology can effectively help patients explore the connection between body and emotions. The following is the setup process of applying body mapping technology, including the steps for preliminary evaluation, determining treatment goals, and formulating treatment plans. We will need to the patient's background information collections, and also preliminary discussion on the relationship between body and emotions, and also we need to evaluate the patient's artistic expression ability. And the second, we have to determine the treatment target. We have to set up the personalized goals according to the needs of the patient, and then we have to set the short-term and long-term goals. And finally, we have to make a treatment plan. For example, the selection of creative materials, we have said that, and also the creative guidance. And then we have the discussion and reflection. Also, we will have the continuity and progress. and adjust the plan according to the patient's feedback. When applying body mapping technology in the clinical environment, therapists need to understand the patient's physical and emotional background through detailed evaluation and discussion, so as to set personalized treatment goals. During the treatment process, the therapist needs to provide the patient with appropriate creative guidance, ensure that the creative process is consistent with the treatment goal, and gradually help the patients achieve emotional release, trauma repair, or physical awareness improvement through continuous discussion and feedback. These treatment methods based on artistic expression and can effectively promote the physical and mental health of patients. Now, let's talk about some case analysis. The first one is the post-traumatic stress disorder. Our treatment target is to help Jen express her traumatic experience and related emotions through body mapping technology, improve her understanding of her emotional state, and provide nonverbal ways to deal with and express her inner feelings. First, we will establish a therapeutic environment, and then we will introduce body mapping technology to her. In the creation process, Jen will invite to draw her own body images. The therapist encouraged her to pay attention to different parts of the body, especially those areas where she feels nervous, painful, or emotionally distressed. Jen will use the various of colors and shapes to express the feelings of these body parts. In the discussion and analysis, Jen and the therapist discuss the body images together, and the therapist asks Jen about the choices of different colors and shapes or anything, as well as the emotions she felt in the process of creation. Jen explained why she chose these specific colors and patterns and how these images reflect her inner experience. Finally is the emotional regulation and handling, and the therapeutic effect and reflection. Jen continued to use the body mapping technology during the treatment process, and with the support of the therapist, gradually established more positive emotional processing and self-regulation strategies. The second case is the analysis of the anxiety disorder. Our treatment target is to help Mark express the identify physical tension and anxiety through body mapping technology, improve self-awareness of his emotional and physical feelings, and promote an effective way to deal with these emotions. In this treatment, we will invite Mark to draw his body images, and the therapist will provide the paper, colored pens, and other painting materials so that Mark could create freely. Mark used the rapid brush strokes and irregular lines to express the anxiety in his heart. He drew a blue-red rotating shape in the center of the images, symbolizing his worries about the future and uncontrollable anxiety. So, in the discussion and analysis part, therapist explained to Mark why he would draw these colors and patterns and how these signs can reflect his nervous and anxiety. And in the emotional regulation and handling, the therapist introduced some emotional regulation techniques such as deep breathing, progressive muscle relaxation, and mindfulness exercise to help Mark deal with the anxiety and tension he experienced during his creation. Mark continued to use the body mapping technology during the treatment process, and with the support of therapists, he gradually established more effective emotional processing and self-regulation strategies. The cases number 3 is about the physical image disorder. In this one, our treatment target is to help Emma express and explore her dissatisfaction and troubles with body image through body mapping technology, improve her self-awareness of her body, and seek ways to improve and self-acceptance. First of all, the therapist provides Emma with a supportive environment that makes her feel comfortable and open. And then the therapist discussed her treatment goals with the Emma and explained the roles and benefits of body mapping technology to ensure that Emma understood the process and felt confident. Emma was invited to draw her body images, and she marked her dissatisfied areas such as the abdomen, the thighs, and buttocks on her body images with black and gray shadows. She used irregular shapes and lines to express the uneasiness and anxiety in this area. She added distorted and deformed elements to the images to express her sense of distortion and self-criticism of her body images. Emma also used contrasting colors such as red and orange to express her anger and frustration with her body. Through the body mapping technology, Emma can express and explore her dissatisfaction and trouble with body image in artistic creation now. This method helps her transform complex negative emotions and physical feelings into concrete visual expressions, thus to improving her self-awareness and emotional processing ability. The support and guidance of the therapist enable Emma to understand and deal with her body images problems more deeply and gradually establish a more positive self-acceptance and self-confidence. Now let's talk about the future practice direction, and we'll divide it into two parts: the interdisciplinary cooperation and the development of technology. So we will have some multi-professional team to explore the potential of combining body mapping technology with other treatments, discuss how interdisciplinary teams can work together to provide more comprehensive treatment support, and also study the effects of combining body mapping technologies with other treatment techniques, and analysis how the comprehensive methods enhance the effect and adaptability of treatment. In the technology development, study how to use digital platform to expand the application of body mapping technology, and discuss how digital platforms can provide more creative and interactive opportunities. Explore the application of emerging technologies in body mapping and analyze how these technologies enhance the creative experience and therapeutic effects. Let's move to the conclusion and suggestions. Emphasize the value of body mapping technology in practice, including its contribution to emotional expression, therapeutic effects, and self-awareness improvement. And then we will need to summarize the key experience and successful cases in practical application and show the effectiveness of body mapping technologies in different environments and individuals. Make suggestions to promote body mapping technologies, including providing training and resources for therapists and professionals to improve the application effects and popularity of technologies. Encourage the continuous innovation and development of body mapping technologies, and explore new application fields and technical tools to meet the changing treatment needs. Thank you for watching. In the next chapter, I will bring more content related to the art therapy.